Welcome to our educational video on Jackson-Pratt drains. In this video, we will guide you through the essential steps for caring for a Jackson-Pratt drain following breast surgery. From understanding its function to mastering proper care techniques, we aim to provide you with comprehensive guidance to ensure optimal recovery. A Jackson-Pratt or JP drain is placed after surgery to remove fluids that accumulate in the body, helping to reduce the risk of hematoma formation or bleeding under the skin, and promoting faster healing by keeping the surgical area clear of excess fluid. After surgery, the tissue will swell and release fluids, which are collected by the drain placed under the skin. This drain consists of two parts: a thin rubber tube and a soft round suction bulb. The suction bulb attached to the end of the tube pulls fluid into the drain. Over time, the amount of drainage will gradually decrease, and your doctor will monitor it to determine when the tube can be removed. Depending on your provider's preference, you will be discharged with a surgical bra, which can secure the suction bulb using its loop. If the bra does not have drain loops, you can use safety pins to attach the drain to the bottom front of the bra. Be careful not to puncture the bulb or tubing. Avoid wearing the surgical bra in the shower. Instead, use a lanyard or drain belt to keep the drain secure. This will ensure there is no tension on the drain and will prevent pulling on the sutures where the drain is inserted in your body. It is normal for some oozing and drainage around the drain site. If this happens, clean the area with dry gauze. You can place an additional piece of dry gauze over the drain to help prevent the oozing. Keep the bulb compressed at all times, as this creates the necessary suction. Empty the bulb when it's half full or fully inflated, as it won't generate enough suction. This may cause the drain to become too full and may overflow. To flatten the bulb, squeeze the middle sides firmly and close the cap. Gather your supplies. You'll need a measuring cup, log sheet, and a pen or pencil to record the drainage. Gloves are optional but not required. If you choose not to wear gloves, make sure to wash your hands thoroughly with soap and water or use hand sanitizer. Unsecure the drain from the surgical bra. Strip the drain to ensure the drain tubing stays unclogged by following these steps. Anchor the drain near where it exits your body with one hand to prevent accidental pulling or dislodging. With your other hand, gently pinch and squeeze the tubing, starting from where it exits your body and moving toward the bulb. This stripping process helps prevent clogs with blood clots and ensures proper fluid flow into the drainage bulb. Once you've reached the bulb, release the tubing gently. To drain the fluid, open the bulb cap away from your eyes to release the suction, allowing the bulb to inflate. Be careful not to touch the inside of the cap, as this can contaminate the bulb with bacteria. Turn the bulb upside down over the measuring cup. Gently squeeze the sides of the bulb to let the fluid flow into the cup. Once drained, turn the bulb right side up. Squeeze the sides of the bulb to create suction and replace the cap securely. Secure the drain back in place on the surgical bra. Record the drainage by writing down the date, time, and amount of fluid drained on the log sheet. If you have more than one drain, note the amount from each bulb separately. Bring your log sheet to your post-op appointment to determine when the drains are ready to be removed. This differs for each provider. When you're finished logging your drainage, flush the drained fluid down the toilet. Rinse the measuring cup with water to prepare for future use. Lastly, practice good hand hygiene by washing your hands. Please strip the tubing connected to the drains at least 3 times daily. Empty the bulbs attached to the tubing 2 times per day, once in the morning and once at night. We hope this video provides you with the necessary information and confidence to care for your Jackson-Pratt drain effectively during your recovery. If you have any further questions or concerns, please contact your nurse or surgical team for assistance.